Hi, this is Justin Alexander of Carmel, and the purpose of this video is to instruct you how to care for your dog in the case of an emergency. And the first thing that we're going to start with is assessing what is normal, and we're going to start with your dog's pulse. This is my dog Sammie, and I'm going to demonstrate on Sammie how to palpate your dog's pulse at one of three locations in the body. And first, you can locate it here, under the wrist, which is the carpus, or you can locate it here, under the ankle, which is known as the hock, and lastly, you can locate it here, where the leg meets the inner thigh at the femoral artery. The normal pulse for a medium to large breed dog is 60 to 100 beats per minute, while the normal pulse rate for a small breed dog under 30 pounds is 100 to 140. So next we're going to assess respiration. How we're going to do this is, you can take your hand and place it lightly on your dog's chest. You're going to count the number of times your dog's chest rises and falls within a minute. The normal rate is 10 to 30 breaths per minute. And in the case of an emergency, when you cannot see your dog's chest rising and falling, you can take a piece of small tissue paper and place it in front of your dog's nose to see if it'll move, indicating breathing. Or you can take a small mirror and place it in front of your dog's nose to see if condensation develops. The next area to assess is your dog's mucous membranes. The membranes should be pink, indicating an adequate supply of blood and oxygen to the membranes. If the membranes are pale or blue, this indicates a medical emergency. If your dog's membranes are black, like Sammie's, you can assess the lower eyelid here. Observing how long the gums take to return to their normal pink color after you press on them is a good indication of circulation. After pressing on the gums, they should return to their normal pink color in 1 to 2 seconds. If the gums remain pale or white for more than 3 seconds, this is a medical emergency. CPR is used to treat an animal that either has no pulse or is not breathing. CPR is based on the ABCs of airway, breathing, and circulation. You're opening the airway and assessing that the animal is not breathing. Hold the snout shut as you breathe into the nose and watch the chest rise. Give 4 to 5 breaths rapid. If the dog has no pulse, you must begin chest compressions. Lay the dog on his right side and place the palm of one hand over the ribs, where the elbow meets the chest. Place the other hand on top and extend your elbows. Compress the chest to a depth of about 1 to 3 inches. This is the position for the aforementioned chest compressions. When performing CPR on small dogs less than 30 pounds and medium to large dogs 30 to 90 pounds, give 1 breath for every 5 compressions. For dogs over 90 pounds, give 1 breath for every 10 compressions. Continue CPR until the dog begins to breathe on his own and regains a pulse, while transporting him to the nearest veterinary hospital as soon as possible. After 20 minutes of unsuccessful CPR, the chance of resuscitation is unlikely.
Good job, Sammie.
Yeah.